Dear friends, welcome to our new video. If you are not subscribed the channel, please hit subscribe button and activate the bell button. Have you ever asked yourself about the way in which the blood runs through the body? The blood is responsible for keeping the body clean on the inside and for providing it with nutrients. Every single particle of the body, whether it is in the legs, arms, or head, requires nutrition in order to remain alive and perform its functions properly. It also needs to have access to oxygen and be free of garbage to function properly. Each cell is supplied with food and oxygen through the bloodstream, which also removes waste from the cells. The components of blood. Blood is made up of two parts: plasma, which is clear and liquid, and cells, which are small bodies that make up the majority of the blood. Blisters contain the clear component of blood, which is the liquid found in them. They are so small and closely packed together that each drop of blood contains over 1 million of the cells that float in the liquid section. Only a few of the cells are white, but the vast majority are red, and it is this color that gives the blood its red appearance. 1 gallon of blood is sufficient to cover the entire surface area of your body. It travels through the body in blood vessels, which are branching tubes that branch out from one another. Blood vessels are a type of vessel that carries blood from one part of the body to another. Each of the 4 types of blood vessels has its own characteristics. In the circulatory system, the heart, arteries, capillaries, and veins are all present. The heart is located in the chest, between the lungs, and is a muscular organ. It causes the blood to be squeezed into the arteries as a result of the procedure. These are the vessels responsible for transporting blood throughout the body's tissues. Afterwards, it passes through the capillaries, which are small tubes that connect the arteries and veins. The veins are responsible for returning the blood to the heart. Blood moves at such a rapid pace that it takes half a minute to travel from the heart to the toes and vice versa. Life's pump, or the heart of the matter. When the heart stops, we die because the blood no longer has the ability to transport food and oxygen to the starving tissues. The heart is a muscular sac with thick walls that pumps blood throughout the body. He or she is about the size of your fist and has a strawberry shape to it. It has a cavity that is divided into 4 halves, which makes it easy to transport. The upper 2 are referred to as the auricles, whereas the lower 2 are referred to as the ventricles. After entering the auricles, blood flows into each ventricle, where it is expelled into the arteries through an aperture. This is how the heart works. The arteries, also known as sending tubes, are the vessels that carry blood throughout the body. The blood leaves the heart and travels through the arteries to all parts of the body, supplying oxygen and nutrients. The aorta is the most important artery in the body. It extends from the heart down through the body, in front of the backbone, and is slightly larger than the width of your index finger. In the human body, the lung artery is a large tube that transports blood from the heart directly into the lungs. When the blood is divided here, it can take in oxygen and expel waste through the lungs, allowing the blood flow to be more efficient. Capillaries, also known as feeding tubes, are blood vessels that carry nutrients to and from the body. Finer than hair tubes, which connect the artery's smallest branching end branches to the beginnings of small veins, are referred to as venules. When it comes to the flesh, there are so many of them that you can't stick a pin through it without penetrating one. Feeding tubes are so named because the walls of the tubes are so thin that food and oxygen from the lungs can pass through them to nourish the muscles and other organs. The organs are responsible for transporting the dead components of the body, as well as the ashes of the food that has been consumed, into the capillaries. The returning tubes, also known as veins, are tubes that return blood to the heart. The veins are responsible for returning blood to the heart, and they begin as fine branches produced by the capillaries. Following this, the branches branch out into larger and larger vessels before merging into the vena cava, which is the major vein of the body. Parallel to the spine, it opens into the heart. The reason why blood only flows in one direction is unknown. The heart is in charge of controlling the flow of blood. By pressing its walls together, it forces blood to flow out into the arteries, which is how it accomplishes this. Because there are small doors at the mouths of the arteries in the heart, once blood has entered the arteries, it must continue forward through the heart. Valves are doors that only open in one direction, preventing blood from flowing in the opposite direction from where it should. Additional valves are located between the upper and lower chambers of the heart, preventing blood from being pushed back into the veins and into the body. The inward and outward movement of the heart's walls is referred to as the heartbeat. This can be found by placing one's hand on the left side of the chest and looking down. Adults have a heart rate of approximately 70 beats per minute, however, children have a heart rate that is much higher than this. With each heartbeat, a wave of blood rushes along the arteries to the heart. The pulse is the term used to describe this. It can be felt near the base of the thumb, just beneath the surface of the skin, where an artery passes through the skin. What causes the heart to beat faster at certain times? When we are running or performing strenuous labor, our hearts may beat twice as quickly as when we are lying down. This is due to the fact that the muscles require additional oxygen in order to function properly. In response to their work, they become hungry, and the nerves send a signal to the heart to increase the blood flow in order to bring more oxygen from the lungs to their cells. A common side effect of germ infection is that the heart often beats faster than normal as a result of the poison produced by the germs. The doctor then examines the patient's pulse to determine how poisoned the body is by the poison. It is necessary to use blood cells. The red blood cells perform the function of a boat. They are responsible for storing oxygen in the lungs and transporting it around the body. Here, they exchange it for carbon dioxide, which is a waste product. They transport this back to the lungs, where it will be expelled from the body by the body's natural processes. One white blood cell can be found for every 400 red blood cells in the body. White cells protect the body from harm. They have the ability to change their shape and crawl through the capillary walls by altering their form. In large numbers, they congregate wherever the body has been injured, where they consume the germs that are constantly seeking to enter the body through open wounds. It is the white stuff called pus that forms in a sore when white blood cells arrive to fight pathogens and are destroyed during the battle. Bacterial infections such as boils and fevers cause germs to enter the bloodstream, but white blood cells usually kill them before they have a chance to multiply and cause illness in the body. Stopping yourself from bleeding, what you need to know. The majority of the larger arteries are located deep within the flesh and are only rarely severed in this manner. It is possible to see a number of veins just beneath the surface of the skin. If the blood flows out in spurts, the vessel is an artery. If the blood flows slowly, the vessel is a vein. If the blood does not flow out in a stream, it will stop on its own without any additional assistance. The congealing of blood into a jelly-like mass known as a clot occurs when blood enters the air. This aids in the cessation of the flow of water. The bleeding can be stopped by wrapping a bandage around a leg and twisting it tight with a stick. The limb should be on the side of the wound that is closest to the heart. If a vein has been cut, place the bandage on the side of the wound that is away from the heart to prevent bleeding. Alcoholic beverages have a diluting effect on the blood. Over the course of several years, it has been observed that when a person consumes beer or whiskey, their fever is significantly more severe than when they do not consume alcoholic beverages. In a recent interview, a well-known scientist who works in Paris explained why this is the case. He inoculated rabbits with illness germs, but they did not become ill as a result of the vaccination. They became ill and died after he administered a small amount of alcohol along with the same number of disease germs as before. In the first instance, he discovered that the bacteria had been destroyed by white blood cells after conducting a thorough investigation. According to the second experiment, the alcohol caused the blood cells to become so weak and lethargic that they were unable to effectively fight the bacteria. Cigarette smoking and blood are two words that come to mind when I think about tobacco use. A significant amount of the poison is absorbed into the bloodstream of anyone who regularly chews or smokes tobacco, according to the CDC. It is believed that a small amount of fluid, along with the poison from the smoke, is absorbed by vessels in the mouth and throat. Although it is unclear how much of a negative impact this poison has on blood cells, it is likely to cause them some damage because it makes the body's growing cells less active. The heart's weakness as a result of consuming alcohol. Whiskey was once thought to be good for the heart, but doctors now agree that it actually does the opposite and weakens it. Although it may temporarily increase the rate of the heart's beating for a few minutes, the heart will eventually return to its normal rhythm. In some studies, beer consumption has been linked to an increase in fat around the heart and a conversion of some heart muscle to fat in other studies. As a result, the heart becomes weak to the point where it is no longer able to function properly, and death occurs. According to German statistics, hundreds of people die each year as a result of weaker hearts caused by an excessive amount of beer consumption. Alcohol has a negative effect on the blood vessels. Alcohol has thickened and, in some cases, hardened the walls of the blood vessels of drunkards after they have died, according to a study of the vessels after their deaths. As the wall of the tube thickens, the channel of the tube becomes smaller. As a result, the heart has to work much harder in order to deliver the blood to the tissues. Tobacco and the heart. Many teenage boys who smoke cigarettes on a regular basis have irregular heartbeats, according to research. Individuals who smoke a large number of cigarettes on a regular basis, in particular, should be aware of this. When our country was at war with Spain a few years ago, thousands of young men who were interested in becoming soldiers were subjected to physical examinations to ensure that their bodies were capable of withstanding the rigors of combat. The frail bodies of hundreds of men prevented them from being accepted into the military. According to doctors, many of these men had hearts that had been damaged by cigarette smoking and were therefore unable to serve. Smoking is prohibited at the United States Military Academy at West Point and the United States Naval Academy at Annapolis, where boys are preparing to serve in the military. Our country requires strong men to carry out difficult tasks. Tobacco never gives you power, on the contrary, it makes you feel powerless. If you liked the video, press like and have a look on the references in the description box.